Hi, welcome everyone to the HOPWA Modernization webinar series. Today's webinar will be focusing on planning your HOPWA budget in context of modernization. Just a few notes. Right now, we do have everyone on mute. So if at any point during this webinar you have any questions or anything that you would like to ask, please feel free to ask us via either the questions box or the chat box that you will find on the GoToWebinar screen when you logged in. Thank you.
Thank you and welcome everybody. This is Jonathan Sherwood with the Cloudburst Group. That was my colleague Stephen Ellis, also with the Cloudburst Group, and welcome to today's webinar. We still have people joining, but we will start into the webinar right away. So thank you for joining today. For your information and for your awareness, this webinar is being recorded and hopefully should be available for reviewing later after the webinar. But it is being recorded now. So as Steve said, this is the Planning Your HOPWA Budget in Context of Modernization webinar, the first in a series of webinars that the Office of HIV/AIDS Housing is putting on in connection with the HOPWA Modernization TA effort. Sorry, just trying to advance the screen here. I'll try to. The overview of the HOPWA Modernization goals, I think that this is probably familiar to most all of you at this point through your interactions with the Office of HIV/AIDS Housing, through previous webinars, material that you would have been provided, and likely interactions with your TA provider as part of this effort. But we just wanted to start with a quick overview of the HOPWA modernization goals because this is these goals are pretty directly relevant to the topic of today's webinar. The Office of HIV/AIDS Housing established a set of values to guide the implementation of HOPWA modernization. And for those of you who may not recall or are in fact new to this effort, what we're talking about when we say HOPWA modernization is when a couple years ago, Congress, in renewing through the annual budget process, made changes to the formula by which HOPWA funds are distributed to communities. That's the modernization part, bringing that formula more in line with the current state of the HIV/AIDS epidemic. And that modernization, that change in the formula, had some very direct impacts on the funding that some communities will be receiving. Some communities will be seeing increases in funding based on the new formula. Some might see overall reductions in funding. And so as part of that modernization effort, that formula impact is phased in through fiscal year 2022. So there are a number of years left in that, so that the impact of those losses and gains are smoothed out over those years. So that's the modernization is referring to that change in the formula, and HUD has initiated a technical assistance or TA effort in connection with that change to support grantees with planning and planning around that potential change in future funding. As part of that, they developed a number of value statements and propositions that they've oriented all of the TA around, including no person should become homeless as a result of HOPWA modernization. All funds should be used to meet the needs of eligible households with no funds recaptured from grants, and grants should ensure their project designs meet the changing needs of the modern HIV epidemic with the goal of positive health outcomes and reduced viral loads for HOPWA-assisted households. So in connection with that technical assistance effort, the Office of HIV/AIDS Housing has tasked a number of technical assistance providers who you can see on the slide here listed on the left to assist the office with working with grantees on these changes. The Cloudburst Group, where I work, is part of that effort, and we're leading today's webinar. The overall effort is being led by the Technical Assistance Collaborative, or TAC, and then also partnering on it is Collaborative Solutions, who many of you are very familiar with from prior work. So the three of us, the three firms, are working with the office to help implement that vision for modernization. A quick preview. There are some upcoming webinars. As said, this is the first in a series, and these webinars were developed, are being developed, the topics were developed in connection with the Office of HIV/AIDS Housing, as well as the other TA providers, informed by our conversations with grantees who are being significantly impacted by the changes in funding. So these webinars are being offered over the coming months, really in complement to the direct technical assistance that is being provided through the TA team of the three firms that I've already mentioned. So stay tuned. You can see the dates here. This presentation will be made available after the fact to you, and you've probably already received information about these upcoming webinars, but the dates are here for reference, and you can see which ones might be most relevant to your work. So to today's webinar and the objectives for today, we have a fairly focused session today. It is not on everything that you might think about in terms of budgeting and planning. It really is trying to look at some specific issues that we think are important in the context of modernization and the changes in funding and how that might impact your community, but also to roll out a toolkit to help you with some of that budget planning. So we'll be reviewing budget planning challenges that may be presented to you to modernization phase-in for the HOPWA Modernization Highly Impacted Communities, or the HIMHIC grantees. So I'll use that phrase HIMHIC a few times throughout this presentation, and you'll hear it likely in other webinars as well. And that's what it's referring to. There are communities, the HIMHIC communities are grantees that were identified as particularly being impacted either by potential increases or potential losses in funding over the next few years, and were identified for this directed TA. The second objective, enhance your understanding of multi-year cost drivers and dynamics in your budget planning, and introduce budget projection or full forecast toolkit for budget forecasting and modernization planning. We'll be looking at that tool throughout the webinar, and then to talk about some budget planning strategies. As Steve said at the start, we're going to try and not have a lot of live questions, just because we had almost 100 people sign up for this, and we've got about 75 on at the moment. So just to keep us moving, but please do, if you have questions along the way, submit them through the dashboard, and at its discretion, Steve will be monitoring those and may pull some in during it. And if your questions aren't pulled in, we'll certainly have them to help us respond after the fact to questions that you had along the way. So stating the problem that we're trying to address here, both with the tool and with today's webinar. What budget challenges do highly impacted communities face? You're going to be, as a highly impacted community, a HIMHIC community, you're going to be managing swings in funding over the next few years while trying to maintain housing stability and avoiding homelessness among households served through your HOPWA grant. That goes to the heart of the first, one of the values that we had at the first slide. That's at the heart of what OHH is trying to achieve with this TA, is helping grantees manage these changes and minimize impacts on client housing stability. We also will, you're going to face challenges potentially accurately projecting future costs, as well as thinking about what future allocations might be. The central issue that the toolkit that we'll be looking at is trying to address, and that the TA will offer after the fact to help you use the toolkit, is aligning those projected allocations through 2022 with your local needs and spending patterns, and to really help you think about kind of go inside your own numbers a bit and be able to think across multiple years in terms of what your options might be. And then I think fair to say a number of grantees will be having to factor in to either their potential losses or gains in funds, unspent funds from prior allocations, which come with time limits, and there may be pressure to spend those even as you are trying to respond to future changes. So there's a good number of moving parts involved in trying to think about multi-year projections, and so that's what we're going to be looking at today. So to frame us up a bit before we start looking at the tool that we've developed, want to talk about what some of the special issues that, at least from our end, we've identified, and you may very well have more that you'll want to bring to your discussions with your TA provider in follow-up to today's session, or later when we have the opportunity to take questions. But we think that there are a number of fairly straightforward issues that may come up for both loss and gain communities. So HIMHIC grantees who may be losing funds may face particular planning and budget challenges around the up and down variations from year to year in allocations for some grantees. This has been covered last year's HOPWA Institute, and I believe on at least one or more of the webinars that OHH has put on to talk about modernization. Is one of the effects of that hold harmless or phase in formula for through FY22, of how the formula is, the impact is phased in over time, is that there are actually some grantees who, even though their funding trend may be in one direction or the other, either up or down, there may be years in that process, HUD is projecting that their allocation will go in the opposite direction for a year. So there are grantees facing these up and down variations. There are grantees who are having decreases in funding, maybe losing a substantial percentage of overall funding, even as their costs for providing their services go up through inflation and other cost drivers. Also, grantees may have, and their project sponsors may have, what we're going to be calling commitment investments in committed or multi-year costs that are directly connected with housing households. and those costs can be hard to shift. And we'll talk more about that coming up, but that I think is an important concept and challenge that communities might face. Finally, communities may lack other resources in the community that might help offset some of the decreases in funding. Or they may not have strong or established connections with other resources, including Ryan White and continuum of care resources. On the other side, grantees who are facing increases in income that are out of variance with the norm of what they might face year to year may also have challenges. Just as we're saying with the decrease in communities with decreases in funding, there may be a lack of local capacity to expand existing programs or to take on new HOPWA activities as a way to absorb increases in funding. That is a challenge that has come up for a number of grantees so far through this process. They may already have moderate or slow rates of spending, and so an increase in funds may have the potential to kind of swamp current capacity to spend money. So that can be a real dynamic, and as again we'll talk more about this later, as those kind of slow rates of spending stretch out into future years, they can result in piling up of unspent funds that have time limits on them and the clock is running out on. And you'll recall that one of HUD's goals is to avoid the recapture of funds. And that gets us to the last one here, unspent or unobligated funds from prior years. So having an increase in funding just compounds the challenge of obligating and spending older money. One of the things that we wanted to talk about for your budget planning, you really can't talk about budget planning in relation to modernization without the projections that the Office of HIV/AIDS Housing has generated a couple versions of to this point and provided to grantees. So you should have received these in the past, and if not, you can follow up with your grantee or with your TA provider, and we'll make sure that you have a copy of your current projections. But the Office of HIV/AIDS Housing has provided these projection sheets that estimate potential future HOPWA allocations in the context of modernization for each year through FY22. So these projection sheets have been generated not for every single HOPWA grantee in the country, but specifically for the highly impacted communities, the HMHIC grantees. These projection sheets are based on two possible scenarios for future congressional funding, and they're really for planning purposes only. As we saw, I think this year, the FY18 is a good example. There were projections generated last year for the Institute for HMHIC grantees, and then exceeding everyone's, I think most everyone's expectations about what might happen with the FY18 budget. The HOPWA budget, a line item in the federal budget, was actually higher than expected. So that was a good example that congressional action, even with these projections, they are merely that. Congressional action is independent of these projections, and future congressional decisions may bring in numbers that are higher or even lower than the range that's contained in those projections. So what OHH has done is provided two projections for each of the grantees, a high or a low amount that's based on certain assumptions that are contained in those projection sheets, and again are for planning purposes only. And they most recently generated those and provided them to grantees in April. this year, shortly after the FY18 budget was approved by Congress. So again, if you don't have those, your TA provider can help you get a hold of your current copy. We have that current set available to us by HUD. Here's a quick picture of what they look like, just to remind, and I wanted to go into the projections because these projections are built into the planning toolkit that we have. So these projections that are provided by OHH for each of the HIMHIC grantees are really a key feature of the planning tool, the budget forecast tool itself. So I wanted to make sure everyone was familiar. This is a screenshot from one grantee's projection sheet, and you can see this is a community that is losing funds. You can see on the top is the low projections. By FY22, they've gone from potential 7.3 million in 17 to 6.036 million in FY22. On the high side, that FY22 numbers at 6.859 million rather than 6.036. And both of those are based on assumptions that are only best guesses, possible scenarios using some budget amounts that they had available at the time. So these projections, my understanding from OHH is that these will be updated based on current conditions as we move forward, and hopefully the tool will also be able to update the tool with if those projections change. Let me just pause there. See, Steve, are there any questions yet?
I don't think there's necessarily questions for the webinar at this moment. There might be at the end, though.
Okay, great. All right, we'll keep moving forward. A bit of ground to cover, and I will want some time for this discussion at the end. So I imagine that most of you are very familiar with the basic concepts of forecasting and planning as part of your management of HOPWA funds as grantees. I think we might have some project sponsors on the phone as well, but we're really aiming at the grantees here. But for here, the basic ideas that we'd like to communicate is, and this is as much in the future work with for TA providers with the HIMHIC communities as well as your own practice, to evaluate current activities in the context of needs and other available resources, of course, to understand your current activities and really what are the cost drivers and multi-year dynamics of those activities, because as I think will be apparent and is probably not a surprising thought or unusual thought to think, that different grantees engage in very different patterns of activities. Some highly emphasizing, for example, highly investing in TBRA, others investing highly in supportive services and short-term rent mortgage and utilities assistance, and that sort of thing. And each of those choices about activities that are funded in response to local needs, all of those activities play out differently, I'd say, when you're looking at multi-year spending and planning, especially in the context of shifting allocation amounts. So that's what we'll be looking at, and that the tool hopefully will help you think about those. And with forecasting, the tool will help you think about kind of what if you kept doing what you're doing, and also will give you the opportunities, you'll see, to think about lots of other scenarios that you can put into the tool and project forward. And then finally, for all of it, dynamics. Budgets can be a dynamic thing. Spending challenges can arise that are unexpected, and your or needs come up that you may need to respond to as a grantee, and so you'll be monitoring and adjusting that spending picture over time as well. So the tools that we're providing will hopefully give you, let you get a bit of a view into some of those dynamics. They are not, I'll say in advance, they're not tools that'll take you to the moon. They are tools that are fairly straightforward in plugging in eligible HOPWA activities into future years, but I think that they'll be useful for you. Your forecast will be living documents and dynamic, and you'll want to develop them, I think, with your TA providers, and use the tool as much of a way to explore your costs and future costs as anything else. So a basic idea that I think we'll want to highlight with the tool and looking at the tool, and that is kind of inherent in it, is understanding committed costs and having you think about some costs in terms of being committed, and others, as we'll see in a moment, as being perhaps more flexible or dynamic, or able to be modulated to a greater degree. So committed costs, and this really again goes to the heart of OHH's primary goal of trying to avoid increases in housing instability as a part of modernization. To do that, you really want to make sure you're clearly identifying your costs that represent multi-year commitments. And so that's what we mean by committed costs. They represent multi-year commitments. And I think that they're fairly straightforward here. They're going to be, you can see, really tied in with housing assistance. So what we mean by multi-year commitments are those that will, current year spending represents an expense that is really tied into future expenses as well. A good example about that is with TBRA, right? You may pay, obviously, tenant-based rental assistance is being paid on a month-to-month basis on behalf of a client to a landlord. That landlord may, that client may only have an annual lease, right? That money may be spent out of a contract with the grantee that is only a 12-month contract. So in that sense, there's a clear end date to that assistance. The lease runs out at the end of the year and needs to be renewed. The sponsor's contract runs out at the end of the year and needs to be renewed. But on the other hand, HOPWA TBRA assistance is intended by HUD as being open-ended. Since, of course, terminating assistance for any household that's receiving TBRA assistance would almost certainly result in pretty immediate homelessness, or at least housing instability. So TBRA, every TBRA lease that a grantee or a project sponsor has really represents a known and very likely future HOPWA cost, extending out to some unknown point in the future. So those costs, while they may be tied to a grant to a project sponsor that is only 12 months at a time, that cost represents really a future potential cost. And so in that sense is a committed cost that is really worth looking at in that frame. Similarly, the cost of operating a housing-based, facility-based housing project represents not just the households in there, but also very likely if a grantee is paying for operating costs on behalf of a project sponsor in facility-based housing, that facility represents a real property asset likely owned by the project sponsor, and it's an affordable housing asset that would likely be lost to the community and to people living with HIV/AIDS if operational dollars were withdrawn or not available year to year. So that even though clients may move in and move out of a housing facility, that really represents a future cost or a committed cost. And finally, with supportive services, some supportive services that HOPWA pays for may be connected to housing resources that are paid for through another program, such as Section 8 set-asides or continuum of care housing program, what used to be known as, say, Shelter Plus Care. There's lots of examples where Shelter Plus Care housing dollars were combined with HOPWA supportive services dollars, and the loss of those HOPWA supportive services dollars may well endanger the housing dollars as well. So even services can be kind of hardwired into housing commitments, that if the services are not funded, the housing resource would also potentially be lost. On the other hand, some activities that HOPWA pays for represent costs that may be more flexible or dynamic. And by saying that, I want to emphasize it does not mean that they're less important, just that they do not necessarily, for the purposes of budget planning and future forecasting, represent future housing obligations in the same way that a lease will, or that a facility-based housing support will. So the examples of less committed or more flexible activities we have listed here. The STRMU is really intended to be it's time limited, and it's really intended to take care of a temporal or a short-term problem, not a long-term need. And so the STRMU assistance doesn't necessarily represent a year-to-year commitment to a particular household. But obviously, of course, that's an extremely important activity and program component for many communities across the country. But in terms of budgeting under different pressures, such as might be represented with modernization, these kind of costs represent areas with more potential budget flexibility than, say, the ones we just listed. So with that, I want to start turning to the workbook, and we'll get to that in a minute and open it up, open up the workbook and look at it. I'm going to start introducing it here. So for HOPWA Modernization, technical assistance work with the HIMHIC grantees, the TA team has developed this budget modeling workbook or forecasting workbook for use by grantees with budget forecasting and to support your work with your TA provider, and as well as your own efforts for multi-year planning. So that's the purpose of it, and we developed it in the context of trying to help grantees think about how their costs work if they make certain kinds of changes or certain kind of assumptions moving forward. And they can see, as you'll see, it's really designed to help you test out different budget scenarios and look at the results of those different scenarios directly in the context of your high or low HOPWA projections. And there's 3 sheets in the workbook, and each sheet gives you increasing flexibility in creating your forecast. We started off with 1 sheet and it kept making that 1 sheet more complex, and finally decided it would be best to kind of have three different ways to approach it. So that's what you'll see in the workbook. And some important notes about what's in that workbook. All of the sheets, the workbook comes preloaded with with 2 data sets. The first data set is what every HOPWA grantee reported in their what we on our end call the 2016 program year. That's the most recently completed year's worth of data that HUD has from HOPWA grantees. So we have that information loaded into the tool, and it's not the entire CAPER report. It's really just the basic, and you'll see this all in a minute. It's the basic, how many households served and how many dollars spent for the basic activities. So it's not all the other performance data about outcomes and details like that. It's really just that raw basic information from it. That information is public and is published on HUD Exchange for every grantee through the performance profiles that are published. So it is all loaded in here for all grantees into the one tool. So that's just a word. Everywhere you will be able to look at the spending patterns and costs of other communities, but all of that is public information. So that's just a forewarning. So that's loaded in, as well as the other data set that's loaded in are the OHH projections as of April 2018. And these are the 3 sheets that we'll be looking at. And I think what we're talking about here will start to make more sense as we actually look at the sheets themselves. The first sheet is really what we call a static forecast. And what that means is that it takes grantee 2016 actuals and projects that straight line right out through 2022 with no changes to your activities, and it includes a 1.5% annual inflation rate, so that there is some inflation factor put in there. So it is really a budget picture that looks at what would happen if you did nothing different than what you did, at least as of 2016. How does that look in the context of potential modernization amounts? And the purpose of that for all 3 of these allow you to compare against those projected allocations. And the purpose there is really to let you see kind of what scenarios might look like. And that we think that information will be valuable, that it may make you more anxious or may make you less anxious to actually see where your projections get you to if you do or don't make certain changes. The second sheet lets you, it still presents you with your 2016 information, but it lets you plug in a new baseline year. So rather than taking your 2016 data as a baseline year, you can create a new baseline, but then it'll take that and project it out through the next 5 years for you. So you only have to create one budget, and you can see how that goes out for 5 years. And then finally, the last spreadsheet is 100% user editable, that it doesn't do any projecting of or forecasting. You have to build each year at a time, but you can see them totaled against potential future allocations. So it really gives you increasing amount of flexibility and autonomy in trying out a scenario. But even the static one can give you a lot of information to work with. When you get this workbook, these notes are also in the workbook itself, so I won't dwell on them too much, but there's several important comments I want to put out. When you get the workbook, it's important to point out that to enable the basic functions of the workbook, we couldn't lock down all of the formulas in it. If we lock down the formulas, then some of the basic functions of being able to load in that 2016 data and the projections would fail to work. So what you'll be receiving is a set of Excel tools that that has formulas built into them and some nice functionality, but those formulas are not protected. So you just want to be careful with that, and we've tried to make it as easy as possible to avoid getting in the way of the tool itself. You want to save a blank copy as soon as you get it, so that in case as you play with it, if you do overwrite formulas accidentally, you can always have the blank copy that has those original formulas built in, and of course your TA provider or should be able to provide you with a copy as well. And I would recommend saving versions as you go and test out various scenarios so that you don't lose it. The workbook has what is called a VLOOKUP feature, which means that when you open it up, you're going to be asked, told that you need to enable content. There'll be one of those yellow buttons that pops up in the toolbar at the top, and you'll need to click that in order to allow you to load in your grantee data. So hopefully that is not an issue, and that your IT lets you enable content in an Excel workbook to be able to use it properly, because otherwise a good bit of the functionality would be lost. We provided some very handy color coding that should be pretty straightforward. Green is go. All other cells provide data to you. The only places where we'd be looking for you to enter data are lit up with green. So some key features of this, the first toolkit that we're going to get to in just a second is that, as I said, it presents you with forecast models that are premised on making no changes to what you reported in 2016. One footnote to that is that we do have a feature in there because it seemed to be an important dynamic, even with committed costs, like we talked about already, and that is TBRA attrition. So what we're calling attrition here, we define on the screen here, it's essentially every TBRA program is going to have a more or less natural, normal turnover of households, whether from people moving on from the HOPWA program, perhaps going into other permanent housing, perhaps unfortunately falling into not a negative housing outcome and leaving the program, but one way or another leaving the TBRA program. So in as much as that can be, that varies greatly among grantees, the kind of attrition that they report through their CAPER report, it varies greatly, but we built it into the tool here to give the grantees an opportunity to think about that attrition rate, especially for grantees that are potentially losing funds, as a resource that they might have to not displace anybody off of the HOPWA TBRA program, but nonetheless reduce overall commitments in TBRA year over year by kind of using that attrition rate as an organic way to reduce costs without actually displacing anybody off of housing. So that we'll look at that. And that's based on also from your CAPER reporting, based on prior 5 years of reported performance. So we were able to pull that data out of the HOPWA database. Say grantee X typically has on average 27 households leave the program a year. So there is a built-in 27 attrition rate that you can activate in this forecasting tool, kind of toggle it on and off, and to see what would happen if you stop taking new households onto your program, what the budget effect of that would be. I already mentioned the inflation rate and that they're totaled against the high-low. So I have some built-in slides, but I'm actually going to go to a demo here. These slides, there's some screenshots for your future reference that you'll be able to use. But I'm going to go to it. It looks like I've frozen up my screen. Let's see. So I've opened up the tool itself.
Jonathan,
Yes, sir.
Could you just remind our attendees one more time how and when they'll be able to get their hands on this financial model tool?
Thank you. Yes, this tool will be sent out shortly after this webinar to all the HIMHIC grantees. And it'll also be available through the TA providers. So real quick, there's an instructions screen, which I won't go into that. It's pretty straightforward and will be relevant when you're looking at it. But the first tab is what we're interested in, is the forecast static. So that's what we're looking at now. So this gives you a high level, I'll zoom in on it in a minute so you can see details a bit better, but this is essentially what it looks like. Here on the left, you have the dashboard of your 2016 actuals. Here on the right, and through the right 2/3 of the tool, you have multi-year projections based on those actuals. Here on the bottom, you have loaded in the award high-low down here at the bottom, and then you can see it's totaling up those projections, and you can see how those high-low go against your projections over time. So let me zoom back out just a little bit and go to this first feature. So this is, again, the static one, where all you are doing, all these cells are blue, there's no green, so there are no places on this, this particular sheet where the grantee puts in data. It purely is taking this 2016 data and projecting it forward. You'll see here this red box, it says choose grantee here in the upper left. There's a drop down when you click in the cell next to it, and it has all of the current HOPWA grantees listed in there with the data loaded in for selection. So you will choose your grantee. I'm going to use the City of Houston. I don't know if anyone from the City of Houston is on, but we've selected you to for the demo today. We'll choose them. I'll choose another just so you can see the values change as you select a different grantee. So we'll go back to Houston. It loads in all of the households served in this column. In this middle part here, what the expenditures were across different activities with total expenditures at the bottom. Again, that's in that one reporting year. And then it calculates per unit costs where relevant for some of the housing activities that allows us to, because that'll be used for future projections. So that dashboard is on all three. On the left is on the left of all three of the tools, of all three of the sheets. You'll see the second red highlight. Use TBRA attrition, yes, no. So right now, TBRA for the City of Houston is turned on. They have an attrition rate of 48 based on a 5-year average of reporting. So that's what gets loaded in. So if you keep your eyes on this line here, this is the TBRA line for multiple years, you can see it starts at 384 for 2016 for FY17 with attrition turned on. It's 336, then 288, then 240, and 192, etc. It's taking that amount and subtracting 48 each year. And using the per unit costs from 2016 of 7,749, right? Then calculates with a reduced number, a new calculated expenditure, including that 1.5% inflation rate. So if I take this yes, I've turned attrition on here. If I'm going to take that out, it updates those values. These are now 384 straight across. That says we're not closing our waiting list. We're going to keep putting people onto the program at the current level of service, and it kind of straight lines what that cost will be as well. So you can start to see some differences here. Let me zoom in a little. and look at this year, FY20, with attrition turned off, this would project them spending about 3.158 million on TBRA, but with attrition turned on, that drops to 1.8 million, right? And that's a substantial difference of close to $1.5 million. And those are savings that are affected purely by kind of using an attrition rate that is predictable based on 5 years of prior experience and incorporating that into future planning. So turning this on and off would be saying for a grantee, if we stopped putting new households onto HOPWA TBRA, we'll continue to serve all of the households that we're currently serving, but if we stop using them and we make use of that kind of natural attrition rate, what might happen to our budget? And with, I'll turn this back off for Houston. Let's say they make no change. They go down here, you know, and this year they're pretty close to the high-low, right? It's all pretty close. And the high-lows for that year are the same and for this year, because those are actually based on congressional approved funding. But as we go into out years, if they don't make any change by the year FY22, their current costs are at 10 million and their potential low is at 8.2, right? So if we turn that, go back up, turn that off again, or turn it on, take advantage of that attrition. Remember, they were over 10 million. Just by making use of that attrition and making no other changes to their HOPWA program, they are now under the lowest number of the HOPWA projection, which of course could still, the actual award in FY22 could be higher or lower than either of these numbers. But it gives you a sense of kind of like what are some of the dynamics that can bend that total in one direction or another. So I'm going to go back. So that's the static form. It takes those FY16, puts it straight out, with the exception of being able to turn on the attrition. I think that you'll probably have plenty of questions after the fact. That we'll see how much time we have at the end, because time is flying by quickly. But remember, I'll just remind, this tool is really intended for use with your TA provider and follow up to this to really be able to dive in to your budget planning if this is helpful. So the second spreadsheet here has that editable baseline, and this one is good to use. It doesn't require you to build multiple years of a budget model, or really just build 1 year, and it can look however you'd like it. You can do completely new or different activities or different levels of activities and experiment with it. But it doesn't require you to do all 5 years. You just do it once and it'll take that and project it out. So you can kind of see what different scenarios look like with that. And it still has the same, it uses the same actuals, and it uses the 1.5% inflation rate. The one feature of this, and we'll get to it, we'll jump into it just in a second. One feature of this one is the way it's set up to calculate those future expenditures. It's really driven by, instead of raw total expenditures per activity, it asks you to plug in households served and per unit costs. And we'll talk about why in a second and what that looks like. And then it's totaled against the high-low. So let's dive in again to the tool and go to that second tab. So you'll see it has the same dashboard on the left here. It's still the city of Houston. That whatever grantee was selected on the first tab flows through all three of these tabs and loads in that same dashboard on the left side. What you'll see different here is whereas the last sheet, all the columns were blue, there was nowhere to plug in information. There's a lot of gray. In this one, you have two columns that are green, which means go, which means that's where you put in data to set up some scenario expenditures. And as I mentioned, instead of just plugging in raw costs, we think it's valuable for you to have to take the step of plugging in projected households served and per unit costs. So instead of just having a total target cost for an activity, this kind of makes you connect that target cost with a household served. So let's say, we'll just stick with TBRA. That in 2016, it cost $7,749 per household on average to provide TBRA. So you plug that in, or let's say you want to increase it for safety's sakes, you think it'll cost $7,900, and instead of serving 384, you want to actually, for the purchase scenario, let's say increase the number you serve. So you can plug that in, and it'll generate that overall expenditure, and then it will project it out into future years with new totals, new per unit costs that include inflation, et cetera, et cetera. Or you could say, okay, we want a baseline year where we're going to start with 384 for TBRA, and you go ahead and duplicate some of these committed costs, but you come down and say, okay, for supportive services, we're only going to serve 1,000 at that same kind of per unit cost, but a smaller number of people for supportive services. So you can kind of plug in different scenarios of saying, okay, we think we're going to be able to replace some of those supportive service dollars with Ryan White dollars. We think it'll let us go from 1,400 to 500. But we're going to keep we want to keep our STRMU at the same amount. So you can see that you build it, and very quickly it populates those out years with projections, and lets you start to build up a new total down here. Obviously, that total won't really be good to work with unless it includes all of your costs. Like you'll see that we make no assumption about admin, even though, of course, you can charge up to 3% for grantees and 7% for sponsors. Not every grantee and sponsor does that. So we let you plug that in here. And you would do the same for these other costs as well. So this one lets you, without overcomplicating it and without having to go through the whole process of filling out every single year, really fill out one year maybe using your 2016 data as reference, right? You've already got known expenses and known per unit costs there. You plug them in here, and you can reduce or increase the numbers and build a new budget, and then very rapidly see what that looks like in future years and how that relates to your projections. So to go back to our presentation, keep moving because I do want to make sure we have some time for questions. We're closing in on the full content here. I do want to mention grant-based accounting just as a flag for both you to keep in mind as you move forward, and for your TA providers to keep in mind in talking about budgeting. Grant-based accounting, if you're not familiar with it, in 2015, HUD was required to make a change in the way that they managed and booked their drawdowns from grantees, changing from what used to be called colloquially the first in, first out, or FIFO basis, where even though you grantees were given individual awards, as far as the account tracking and IDIS was concerned, when you book a cost in IDIS, it drew against the oldest money that you had. That was required to be changed in 2015, and now you're always having to book every cost against a specific year. And why we think that's important to note here, we've provided a link to some information on the HUD Exchange website about it. Why it's important to talk about here is because that we think probably has introduced some challenges for grantees. It doesn't change the amount of money that you get, but in some ways it requires a greater attention to the actual tracking of year-to-year expenditures, and we think increases the possibility of grantees having money that gets stranded in IDIS from prior years, because as you create new activities, you attach it to your most recent award. And if you don't spend down all of an old award, it won't automatically get billed against like it used to. And so we're very mindful in the modernization process of having grantees with old or aging money that may be stranded in part through this grant-based accounting dynamic to work with the TA providers will want to work with you to think about how to incorporate those funds into your modernization planning. That really connects us to timeliness and unspent funds as well. That's a perennial issue for all the HUD grantees, not just HOPWA grantees. And it can be, for lots of different reasons, challenges for grantees to spend in a timely manner. And these are some of the terms that we'll be using here. I just had wanted to define them here. Everyone has 36 months or 3 years to spend any given year's award. So that's the timeliness factor. Unspent funds have not been drawn down yet, and unobligated funds are funds in the IDIS system, the HUD's drawdown system, that have not even been attached to activities or obligated yet. So those for HIMHIC grantees gaining funds, significant amounts of unspent prior years represents an additional challenge. So not only are you expecting future increases, you may be struggling to spend older pots of money and needing to get extensions from HUD on that money and coming up with strategies to spend that, even as you're having to reckon with an increase in funds. Similarly with HIC grantees, HIMIC grantees who might be losing funds. On the other hand, those unobligated funds, especially in unspent funds, may represent a resource that you can draw on. And we've talked to grantees already about that. Those unspent funds may be a resource that you can draw on to help you buffer those losses in funding moving forward, taking into account the time frame that you have to spend those prior year unspent amounts. And for all, the grantees will need to be mindful of the spending deadlines for any unspent and unobligated funds, and work closely with your HUD field office and headquarters staff to identify those challenges early and to work with them and potentially with your TA provider to come up with strategies to spend that, because again, it was one of the modernization TA values that HUD wants to avoid the recapture of funds through this process. And so just a reminder, in some cases, extensions can be given by HUD on that spending. So There's a last slide or two here about strategies for response that I'm going to cover, but I'll remind everyone, as I said at the start of this webinar, that all of these topics really about strategies are what future webinars will be about, and B, what the work with your TA provider can really be about. So we'll touch on them here, but maybe not go into all the depth that we potentially could. In fact, the third bullet here, expand coordination with other systems and resources. The very next webinar is, or an upcoming webinar, I'm not sure if it's the next one offhand, an upcoming webinar is on that very topic of working with Ryan White CARE Act resources in your community, specifically in the context of modernization. So we'll have an entire webinar devoted to that bullet. So consider, as we've already touched on, consider if you're facing decreasing funds, if you do TBRA, looking at the attrition rate of that TBRA activity as a resource to help you manage the loss of funding at a measured rate without having to set caps or start displacing people from it. That data is known. It's, like I said, fairly predictable. It's of course not guaranteed that you'll have X number of people leave your program every year, but that it is based on 5 years worth of your own data for those rates. So consider using that. Using the tool, we'll look at a multi-year view. One thing that we couldn't really build into the tool because it would have become even more complicated, and we wanted to keep it as simple as possible, is how to factor in, if you do have unspent or unobligated funds, how to factor that into your picture. I mean, I think that on the practical level, you could still use this Excel tool and probably even at the bottom of those columns add in what some of your unobligated or unspent resources might be to give you a picture in addition to the high-low allocations of what you might expect. But we couldn't build that in, couldn't do everything with the tool. And of course, continuously review and update your understanding of local needs and priorities through the process. For communities with increasing funds, same as on the other side, expand coordination with other systems and resources. There might be opportunities for collaboration and partnership with other housing and community organizations that maybe you haven't worked with previously in order to meet unmet needs or expand the range of unmet needs that you're addressing in your community through the increase in resources. Be sure to charge, this is a perennial topic and a lot of TA engagements. Be sure that you're charging all the eligible costs for your HOPWA award. For example, like with the TBRA program, making sure you're not just charging the program with the TBRA, the leasing costs, the payments that you're making to a landlord on behalf of a client, but also the overhead costs that you have for directly providing that TBRA program, the housing, the eligibility determinations, income determinations, rent calculations, housing inspections, housing re-inspections, all of that. Those are direct costs, not admin costs, but are direct program costs. And make sure, again, if you're in the position of having an increase in funds, make sure that you're actually getting reimbursement for all the eligible costs that you may have. As with on the other side, plan spending with a multi-year view and look at those unspent, non-obligated funds and make sure you factor those in and identify as early as possible if you have unspent funds in addition to increases in funds. That you may need support in thinking creatively about how to spend. All right, we're going to do a very quick look at the last tool here, the last sheet in the toolkit. This one still loads in that FY16 information for your reference, but everything else is fully editable. And let me pull that up. So here you'll see every column is green except for the blue columns in the middle. That's where the expenditures are calculated. So if you enter the household served and you enter the projected amounts, you'll get the estimated expenditure, and you'll note that for every year, it's all green. So it's building each one individually. It doesn't do any projecting for you, but it lets you kind of, and there's no inflation factored in because there's no year-to-year carried over costs. So it lets you plug in for one or multiple years, kind of at the same time, look at multiple budget scenarios side by side, and it still has those 17, 18, 19, 20 on through to 22 actual projections built in. These numbers on the dashboard, the 2016 dashboard over there on the left, let you say, okay, I see what our numbers were in that year. That's a reference point for per unit costs or for households served, but everything in here is user generated. So that one is much simpler. There's not as much to turn on and off. It just lets you work right through it. And this is our last slide here. So putting it together, work with your TA provider and on your own to fiddle around with the tool. Hopefully it will be helpful to understanding your current spending trajectories. It might, in the context of the discussion today, understand what spending you may or may not be able to easily change, but also within those dynamics, what do changes look like if you try out different scenarios. It helps you understand the effects of different planning choices on overall spending, reducing the scope of a STRMU or case management program, for example, or doing something like expanding your TBRA program. What will the effect be? Remember to use unspent funds strategically during this transition and identify those unspent funds early as a dynamic in this budget planning. And then, of course, moving forward, continuing to monitor your spending patterns. If you do have trouble now or on a regular basis with kind of timely spending in the context of the pressures from modernization, that could really compound your challenges. So the TA providers are here to help and to work with you, to work with your field office staff or your headquarters staff as well to work out any of the challenges that all these different budget pressures might represent. So I thank you for your time. I know that I've barreled on through, but we do have some time here. And I'm interested in if you have questions, especially about the presentation. I think once you try out the tool, you'll have questions about that, but we'll, I think, work with your TA providers on those specifics. So thank you.
Jonathan, we have a question about how grantees might be able to use this budgeting tool and share that information with their project sponsors and community.
That's a good question. I think that it's really up to the grantee to decide how they're going to use the information. It's as said at the beginning, there's nothing in the spreadsheet or the toolkit that's proprietary or insider information. It's all public and published. It's just brought together here. So it is your grantee information. And I would say if it makes sense for a grantee in your public process with planning with your project sponsors to work on scenarios or talk about scenarios or demonstrate them or get their input on them, that is a great idea, and there's no reason not to use the tool along with your project sponsors. And I think you could decide for yourself if even sharing the tool with your sponsors for them to do some scenarios at their own level could be helpful as well. So that it's not a, this isn't like the CAPER report document or something like that, where it's an official document and it has no restrictions on it. So once we release it into the wild, it's really yours to use. And if you identify ways to use it creatively to meet your goals, by all means should.
We have another question about future webinars. The question is if project sponsors are welcome to be part of any of the future webinars, or are they for grantees only?
I know that our focus is on the grantees. That's for the TA effort. That's our client, as it were. And I think Marie, I don't know if Marie Herb's on and would want to weigh in on that. I think that we want to make sure that we have the resource first available to the grantees, because that's our primary target. But I think that some of the information would be useful for sponsors. So I don't know if we want to eliminate them, but we do want to make sure that we get the content first to the grantees.
Thank you, Jonathan. That seemed to answer the question. Are there any more questions in regards to this webinar, the tool, or future webinars? If you do have any future questions about this webinar or the tool, please feel free to reach out to your grantee, as they will have direct information, or if you are the grantee, to reach out to your technical assistance firm, as we would be more than happy to assist you with any questions that result later. I think that's all the questions, Jonathan.
Okay, great. Well, thank everyone for joining. We had a great turnout, almost, I'd say about 90% turnout from the registrants. So thank you very much for participating, and please tune in to the future webinars in this series. And with that, I'll stop recording, and thanks again.